Hi, folks. Welcome to What's Gay in PA, where we share news stories and events that impact the LGBTQ plus community across Pennsylvania, from Philadelphia to Erie and all points in between. Today's show is brought to you by Powered by Rainbows, starring Matt Haslam of Matt Haslam Productions, and by Aura Jewelry by Mary Moore. If you are looking for inexpensive jewelry, check out her Etsy page for details. We open today with a more in-depth report. In April 2020, nursing homes were overwhelmed with patients who had COVID-19, but who no longer needed to remain in a hospital setting. Nursing homes across many states, Pennsylvania included, established entire wings for patients who were recovering from the virus. To accommodate the extra patients, nursing homes needed to hire, and rather swiftly, nurse aides to assist with the sudden increased demand. As a way of easing the burden on states and removing some of the bureaucratic red tape, the Centers for Medicare and Medicaid Services, also known as CMS, suspended federal regulations to assist in the hiring of nurse aides. Pennsylvania's plan, as granted by the federal waiver, was to authorize individuals seeking to be hired as temporary nurse aides to complete an approved 8-hour online training and pass a 50-question exam. After successfully completing 80 hours of on-the-job training under the direct supervision of a licensed or registered nurse, their temporary certification was to become permanent. Although many temporary nurse aides were hired in nursing facilities and contracting agencies across Pennsylvania, those same people would have been forced out of their jobs because once the waivers expire, these same aides who had provided exceptional care in a nursing facility for 4 months would suddenly find themselves unemployed because they would no longer be deemed qualified or eligible for the state nurse aid registry. Prior to November 2020, the law required an individual to successfully complete a state-approved training and evaluation program in order to be employed in a skilled nursing facility. In Pennsylvania, approved programs consist of 120 hours of in-class and clinical training, as well as a 2-part exam. However, Pennsylvania State Senator Judy Ward introduced a bill to amend state law to allow the temporary nurse aides to be hired during the declared emergency if they met a certain level of training, testing, and experience. They would have to first successfully complete a training program and competency assessment authorized under the CMS waiver, including online training and an online examination. Second, they would have to complete a minimum of 80 hours working as a temporary nurse aide under the direct supervision of a licensed or registered nurse. And third, they would have to establish competency by successfully completing the state nurse aide exam, certification by a site administrator as part of an approved apprenticeship program, or through an assessment by the hiring entity in all areas of required nurse aid training set forth in federal rules. The legislation was met with fanfare from the Pennsylvania Healthcare Association and Leading Age Pennsylvania. The law was supposed to provide a path to full-time employment as a certified nurse aide. As Senator Judy Ward's memo to her colleagues said, for those who have served admirably and compassionately as a nurse aide during the severe challenges of caring for our most vulnerable during the COVID-19 pandemic. That was the plan. In theory, it should have worked. Governor Tom Wolf signed the law into effect November 25th, 2020. At that point, the Pennsylvania Department of Health and the Pennsylvania Department of Education were supposed to work together to build a form for the temporary nurse aides to attest to their on-the-job training, their work, and their exam scores. The departments were supposed to provide guidance to nursing homes and contract agencies about what to do with the temporary nurse aides as their 4-month window for work began to close. That didn't happen. Yes, the governor signed the bill into law, which is known as Pennsylvania Act 138 of 2020. However, the pandemic had already forced most of the employees from these departments to work from home. From December 2020 through March of 2021, no forms were posted online for temporary nurse aides to submit their credentials. When April finally came, 5 months after passing the bill, the attestation form and instructions for the form became available for the public on the PDE website. It's important to note, Pennsylvania has a third-party company, Pearson VUE, that manages the nurse aid registry for the Commonwealth. They are tasked with keeping track of all the nurse aid information. In March, per an email we received at Pennsylvania Equality Project, Pearson VUE was unable to assist the temporary nurse aides with the registry because, quote, they hadn't been given the guidance needed by the Department of Health. A phone call to the Department of Health revealed that the nurse aid registry forms were handled by the Pennsylvania Department of Education. So, a call to the Pennsylvania Department of Education revealed that the Career and Tech Education branch of the department is responsible for the nurse aid registry. That same phone call also revealed that only one person in the entire department has access to information in the database to tell whether a temporary nurse aid certification paperwork has been processed or even received. One member of our board of directors had submitted his paperwork to Pearson VUE. In mid-May, he was told to check back in 2 weeks. Your file is pending. That's what he was told. A phone call today revealed that Pearson VUE is not handling the paperwork from the temporary nurse aides. He was referred back to the Pennsylvania Department of Education. After 3 hours of telephone time, he finally gave up. He walked away, discouraged because no one in the branch, for that matter, any branch of the Pennsylvania government, could help. He even called Governor Wolf. His office told him to contact the Pennsylvania Department of Health. A phone call to Senator Judy Ward's office revealed that the senator is planning to meet with the Pennsylvania Department of Education and the Department of Health in the next 2 weeks. Our board member doesn't have 2 weeks to wait. He is presently on unemployment. The reality is the temporary nurse aides whose jobs are on the line are facing the exact fate that the senator's legislation was supposed to prevent. So why is this important to our program? How does the temporary nurse aid crisis impact the LGBTQ plus community? We have identified 2 ways. First, the shortage of aides in nursing homes puts the remaining staff under immense pressure. LGBTQ plus patients in nursing homes frequently lack the family support structure to assist them in times of crisis. They don't have people to whom they can turn for help. A broad coalition of LGBTQ groups led by the National Senior Citizen Law Center released the following report. Groups involved in the report included the National Center for Lesbian Rights, Lambda Legal, the National Center for Transgender Equality, the National Gay and Lesbian Task Force, and Services and Advocacy for GLBT Elders, or SAGE. The report collected information and stories from 769 individuals who responded to an online survey. Of the total respondents, 328 people reported 853 instances of abuse, including harassment by residents and staff, refusal by staff to accept a medical power of attorney, refusal by staff to use names and pronouns that the residents requested, refusal to provide care, and wrongful transfer or discharge. Nearly 9 in 10 respondents said they thought long-term care staff would discriminate against someone who came out in a facility. 8 in 10 responded that they would expect mistreatment or bullying from nursing home residents, and 1 in 10 reported that the same would happen from nursing home staff. They would disregard a medical power of attorney when it was assigned to a resident's partner. Transgender elders in particular reported that they experienced isolation and staff refusal to recognize their gender identities. The added pressure caused by reduced staff will only exacerbate these problems. The second way this impacts the LGBTQ community is equally disturbing. Many of the temporary aides hired at nursing homes are a part of the LGBTQ community. Their jobs are at stake. Their livelihood and ability to pay their bills is on the line. In our case, a board member is the one who is seeking help. He's seeking help. He's facing a major setback until the Pennsylvania Department of Education, the Department of Health, and Pearson VUE can finally get on the same page. Until then, most of the stakeholders involved are losing: the patients and the staff. I'm sure Pennsylvania Department of Education and the Department of Health are doing just fine. Now it's time for the rundown. If you've been looking for a lengthy list of various Pride events, check the Pennsylvania Youth Congress's website. However, if you want to hear a quick list, here it is. On June 5th and 6th, Gettysburg and Pittsburgh will be celebrating Pride. On June 6th, Pocono Pride. June 8th, Fox Chapel. June 26th, Warren, Millvale, and Hanover will all be celebrating their Pride events. On June 27th, Upper Darby will be celebrating Pride. On July 18th, Bucks and Montgomery County Pride will take place. On August 22nd, Reading Pride will kick off. And on September 4th, Labor Day weekend, Philadelphia will be celebrating what they're calling Pride Light. If you have news or events you would like us to mention on our show, send story ideas to info@paequality.com. For events, please allow up to 1 week prior to the event for us to include it on the program. Thanks for watching today. If you like today's show, give us a thumbs up and be sure to subscribe to our channel. Check in again tomorrow when we will have another edition of What's Gay in PA. What's Gay in PA is a production of the Pennsylvania Equality Project, all rights reserved.